Osmany Mondaca, founder and principal broker of Next Level Realty, part of the series of some interviews I'm doing with some close friends and movers and shakers in Miami. Today we have Mario Gonzalez. He's with U.S. Health Advisors and a close friend of mine of a group we belong to, Gentleman's Journal. How you doing, Mario?
Very good, man. Excited to be here. Excited to be here.
I appreciate you spending some time with us, man. So I introduced you, but tell us a little bit of what you do.
Yep, I actually am a licensed health insurance agent. Enjoy my time helping people find themselves the best plans available to them in the market. So that's just trying to go through every single option and see how I can help every individual get on a great plan.
Awesome, man, because we know how important, especially during these times, to have health insurance, a peace of mind. But, you know, me being an entrepreneur or, you know, independent contractor and a realtor broker, sometimes we don't know how to navigate these waters. You know, if you work at a company, a lot of times you get offered insurance and you just go with what they offer you. But as being a realtor myself, we need to seek those things out. So you help us in that department?
Absolutely. That's the easy part. Like if you get a job that's offering you insurance, you got no other choice. So that's what kind of makes it okay, no big deal. Like I can handle this. But you know, like when you're a 1099 employee, an entrepreneur, a realtor, it's best to get somebody to help you walk you through it, not just somebody that you're calling at Blue Cross Blue Shield, because obviously they're going to sell you Blue Cross Blue Shield. Nobody's going to help you navigate through the marketplace. So that's what I'm here to do, and I love to talk to people and just navigate what their best options are, whatever they are.
Awesome. So I love having choices, and I like to be able to control my own destiny. Yep. So you're the guy to help me get there. But I need you to break these things down basic for me, man. What's the marketplace? What is this thing that the marketplace is open, Obama? Like, give me a little bit of a breakdown on that.
That's the difficult part. You know, it's a complicated realm of things that nobody makes it easy for us. So basically the marketplace is where you can get insurance if you're an individual. So it was created by Obama. It has the best intentions, but you know, there's pluses and minuses to everything. But basically the marketplace is available to everybody. Whether you're a realtor, you have a job, everybody qualifies for it. You know, people get kind of confused as to, you know, I don't qualify for Obamacare. Basically, all that means is you're not getting a subsidy or government assistance for your Obamacare. So it's got its pluses and minuses. And again, I'm here to walk you through those pluses and minuses.
Awesome. Awesome. Great. So is there a time? So if I start as being a realtor right now at Next Level Realty, and I wanted to get insurance, can I get insurance today, or do I have to wait till the open enrollment that I hear a lot of people talk about?
That's correct. Yes. Open enrollment technically is the only time that you can register for an individual plan of healthcare. Okay. There are certain situations where you're allowed to basically have a special enrollment. So you can basically sign up during those times. But it's mostly, you're only able to have a special enrollment if you already carry insurance. So if you don't carry insurance already, then you're not going to be able to register until technically the marketplace is open from the beginning of October to the end of December. But if you're actually going to qualify for a subsidy, you have to do it from November 1st to December 15th. And that's the way it works.
Okay, so subsidy November. Give me those dates again.
November 1st to December 15th.
15th. Okay. Awesome. Okay. So, but you mentioned that if I did have insurance previously, then I have no gap, I guess what it is, in my coverage, and I might be able to qualify out of those dates. So if I worked somewhere else and they offered insurance and then I wanted to become a realtor, I might be able to qualify in that instance?
Yes, absolutely. You would absolutely be able to have what's called a special enrollment, and you have 60 days from the day you lose coverage. So you might quit June 12th, but your insurance is till July 1st. You have 60 days from July 1st. So an excellent time to reach out and find your best option.
Awesome. Now, me, if I'm the head of household, Mario, okay, I can buy insurance for myself. How about my family and my kids? Do they have to go individually, or is there like also family plans that they offer?
No, everybody will qualify under one person's plan. So if you're the head of the household, you're applying, everybody will qualify. So you're good there. You don't have to worry about that. Everybody's covered under those 60 days or whenever you're going to register.
Okay, awesome. So how different is this from 10 years ago before there was Obamacare? These options were not available to us?
No, these options were definitely available to you, but you had kind of like free reign. You can do it whenever you wanted to. But there was a lot of restrictions with healthcare companies and health insurance providers. Obviously a positive from the Obamacare is that there's no pre-existing conditions. So back in the day, you'd have to go through a bunch of different health insurance providers to see which one you could get if you had a pre-existing condition. The excellent thing about Obamacare now is that, there's no restrictions, and, that helps families out, because you might have a child that has a pre-existing that, previously your insurance company wouldn't take the whole entire family.
Wow.
So those are the good things about that. And then, those are things that you have to navigate through now, because you may not have a pre-existing and there might be other options outside of Obamacare. And those are the things that I help you look at.
Wow, that's amazing, man. That's definitely a big benefit from before. And of course, it's so important to work with a trusted individual that can, help you navigate through these different questions and answers and programs. So, for instance, what's the difference between an HMO and a PPO? Like, what are the basic differences between those two different plans?
All right. So short and sweet, very easy options. HMOs are local, basically like local products. So let's just say you get hurt in Naples. Wow, you like to go to the Keys a lot.
Yes.
You go to the Keys a lot. So let's say you're out on your boat one day and you got to go to the hospital, and you have an HMO in Miami-Dade County. You might be out of network, so you're going to be paying more money. Okay. Obviously, with a HMO, it's a limited network. You pay less for the premiums, but you have more restrictions. Obviously, when you're paying less, you have more restrictions because you're limited to what you can get. Now, the major things on HMO is anytime you need to go see a specialist, you're going to have to get a referral from your doctor. So that's going to be less time that you can spend. You can't pick who you want. So, and again, like I said, it's
so if somebody told me this is the doctor you got to go to, unless he's in my network or I get a referral, I can't just go to that doctor right away and see him.
Exactly. So again, on an HMO, you're limited. So let's say, God forbid you get like a cancer or anything, you're probably not going to be able to go to the Cleveland Clinic, which is obviously, or the Mayo Clinic is one of the best. PPOs, it's nationwide. You can go anywhere you want. You don't have to get any restrictions. You can look up the doctors that you want to go to, get referral from friends, not from other doctors that are probably trying to get some sort of hookup from the other doctor. But, that's the way it works. The PPOs have more freedom and you can go wherever you want. Obviously, they're a little bit more money, but, you have the freedom to go wherever you want, and definitely worth the investment.
Yeah. So if I have a family doctor that we've been using for a long time and he's not in the HMO network, there could be a possibility he's in it, but if not, the easiest route is to get a PPO. Then I don't need to have that concern.
Correct.
If he's on the network or not, right?
Exactly. Yep.
Awesome.
Definitely look at the PPO networks, because most doctors take the PPO network. So most
doctors take the network. They're not all of them required to take it, but it's something that some of them do. Okay. Now, taxes. What's going on with if you don't get health insurance? Then you don't get a subsidy, or if not, you get penalized. Like, how does taxes play into the whole health insurance now?
Well, back in the day when it was first introduced, so when Obama came out with it, the intentions behind it are super. Let's get a big pot and everybody shares it. But some people weren't contributing to that pot, so you were penalized on your taxes. Right now, that doesn't exist anymore. You know,
Wow. Okay.
good and bad. You can go private side and not get taxed, get a penalty on your taxes. You know, not to get political, but the current regime took that away, which is good because now you
Yeah.
have options. So like you still have the Obamacare options, which is excellent, but now you have individual options where you don't need all those benefits that you're getting on the Obamacare side. So right
Gotcha.
now there are no penalties as far as taxes. Really the only thing that affects what taxes affect now is essentially what you're reporting as a household income. So to see if you qualify for a subsidy or government assistance to be able to
Gotcha.
get, you know, less expensive healthcare from, you know, the Obamacare side.
Oh man, thanks for clarifying this, man.
Yeah,
So,
it's not
you
easy.
know, it's not, you know, I guess, you know, there's a lot of lingos and words sometimes that you being in the business or are comfortable using at all times, but maybe some of us that don't do it as often or say it as often don't understand them. So that's gonna lead me to my next question. What's the between deductibles, co-insurance, max out of pocket, co-pays? You know, why should I be concerned about those words or these numbers and when I'm shopping for health insurance?
That's the trick. That's the trick to all of insurance. And at the end of the day, it really comes down to math. Okay.
Okay.
So let's just go simple. Deductible. Deductible is basically kind of like your car insurance. It's basically the uh, the amount that you need to pay before your insurance company is going to pay anything. So let's just
Before it
give it an
kicks in.
example. A $5,000 deductible. Okay, you have to go do a tonsil surgery, and it's going to cost a total of $7,000. You're responsible for $5,000 because you have a $5,000 deductible. That's what you're paying.
Gotcha.
Okay, so now using that same example, you know, now there's $2,000 extra.
Okay.
Your insurance company is going to pay a co-insurance, and you're responsible for a co-insurance. Most of the time,
Okay.
it's an 80-20, depending on the plan that you get. So the
80% them, 20% us.
Correct.
Okay.
So now you're getting into your co-insurance, okay? And then eventually you're going to get to your max out of pocket. Max out of pocket, you know, usually on Obamacare plans and on an individual, you're looking at about $8,000. So you're probably going to get to, on that same example, removing your tonsils, you know, you're getting to the $7,000 mark. On that 80-20, you still have a little bit left to pay because you got to get to your max out of pocket. But
Gotcha.
from this point on, your insurance is paying the 80-20. So once you get to that max out of pocket, then the insurance company is going to pay 100%. Okay. Copays is basically what your negotiated rates from whatever carrier you have, you're going to pay them regardless what happens, whether you hit your deductible, max out of pocket core insurance. And copays are usually what you pay at the doctor, you know, $40, you're going to pay no matter what happens in that situation.
That's that fee you pay right there. Okay,
no
your copay is $20 or whatever it is.
Whatever it is, you're paying that no matter what where you're at in your policy. And that's pretty much the basic point of those.
Awesome. Well, you know, you answered a lot of questions for me, man, and it makes me feel a lot more comfortable in jumping into this. I think a lot of times realtors and maybe some entrepreneurs that don't you know, explore the health insurance option is just because it's confusing for them and they don't know there's a professional out there that can get them, you know, feeling comfortable about the terms and all those things. And the rates, right, Mario, they're very affordable, right? It's not like it's not like Obamacare or is a much higher plans than others, right?
Well, technically, no. Obamacare plans, depending on what get, obviously, and you know, there's a bunch of options where people don't even know, you know.
Don't even know.
Just in, you know, South Florida, there's over 70 something plans on Obamacare. Now, yeah, it could be cheap, but you might be paying for less product. It could be expensive, but hey, I'm not paying anything no matter what happens to me. Then you have the individual side where they're not providing all the benefits that an Obamacare plan might provide, but you might not need those benefits. So that's why it's important to talk to somebody like me, because we'll get you sit down, we'll explore every single option, and whatever works for you, you have a choice. And I'll explain the benefits on each and every side, and you have a choice, whatever you need to make. I'm just there to help you make that choice. But yeah, I mean,
I love that.
It can be expensive and it can be cheap. It depends on what you're looking for. And it's easier to use an advisor to find it.
Well, I love that we have choices, and I think it's very important. Without health, you can't accomplish all the goals and things you want to do in life, or be there for your family and for your loved ones.
Absolutely.
So there's really no excuse now why shouldn't everybody have health insurance.
Yeah.
So
Mario, one thing that I have to say is, I'm sorry to interrupt there, but like,
no, go ahead.
You're not getting insurance to, go to a doctor for cheap. You're not getting insurance for day-to-day stuff. You're getting insurance for the big stuff. God forbid something happen, you're protected. Yeah, you can pay $100 to go see a doctor and you're saving money because you don't have insurance, but God forbid something happens, you're going to be protected. And you're going to spend a lot less money if you have insurance. And you have insurance to protect yourself, to protect your families. And that's the point of it.
That's the point. Awesome.
Yep.
So you got me convinced. We got to do a job to convince others. How do we find you? How do we get those choices? How do we get in touch with Mario and answer more questions and sign up?
My phone number is 305-479-4611. I'm happy to help anyone that thinks that they're paying too much for insurance, not getting enough coverage. Anybody that thinks they can't afford it, I can walk them in the right direction. You can look me up on Facebook, Mario Gonzalez. My business page is Mario Gonzalez as well, with U.S. Health Advisors, so you can find it there. And then on IG too. So you'll see all my information there.
Awesome, Mario. Thanks for your time, man. Appreciate you, my brother.
Hey, I appreciate it, man. And this was awesome. I hope I can help as many people as possible.
You help me, man. All right. Take care, buddy. Have a good one.
Got it. Yep.
Bye-bye.